AASLD President Dr. Gyongyi Szabo is with me now. It is always a pleasure talking with you. And right now I want to discuss emerging trends and really what they are this year, especially as it relates to this meeting.
Well, thank you. Emerging trends are always exciting for AASLD, and sometimes it's difficult to choose between various upcoming issues. This particular year, the Emerging Trends Symposium that takes place at this meeting focuses on liver transplantation in addicted individuals. And that really is a kind of very timely and kind of controversial area, because depending on which part of the world patients are, they may or may not be disadvantaged based on the fact that they have an addictive disorder. Particularly in alcoholic liver disease, European studies suggest that liver transplantation could save lives for patients who have acute alcoholic hepatitis. But as we well know, several patients who have end-stage liver disease may suffer from other type of addictions. And this particular Emerging Trends Symposium on Monday will discuss all of those really critical and fascinating issues.
There are so many important topics, and so then beyond the meeting there is an Emerging Trends Symposium. Can you talk to me about what will be addressed there?
So the AASLD also puts on an Emerging Trends Conference. That is one of our sort of initiatives that has been going on for a few years now. And in 2016, the Emerging Trends Conference will take place in Miami in January, and the topic of that actually is alcoholic liver disease. So it has been recognized that alcoholic liver disease is somewhat of a neglected disease amongst the liver diseases, but it remains to be a major driver for death and cirrhosis and hepatocellular cancer in this patient population. And based on preclinical studies and discoveries in human models and human translational research and animal models really brought us to the level now where there is a lot of interest and a new understanding on the pathomechanisms of alcoholic liver disease, asking critical questions about how to define what is alcoholic liver disease. Is this a patient who drinks alcohol and walks with this alcoholic liver disease, or is that the one who comes to the hospital and essentially presents to us almost at the death door to a certain extent with those who have very severe alcoholic hepatitis. Treatment options for these patients are really limited. Standard of care that we use now has been established over 30 years ago, and there have been really no new therapeutics coming to this area. So with all the discoveries that are being made both in the clinical research and translational research, now we have some potential targets that could be considered for targeted therapies, and there is a really new opportunity to follow up on this.
You touched on this a little bit, but what about the concept of emerging trends in diagnosis and then treatment?
So that very much links to this, because there are several NIH-supported clinical trials, actually 4 major ones ongoing in the United States that brings together a group of experts that will help to answer some of those questions. And in fact, the approach is very much translational, meaning that we are evaluating the various blood-derived biomarkers that we are hoping to use as prognostics and developing essentially new tools for defining disease severity and potentially prognosticating outcomes, and at the same time looking for potentially new therapies. So the conference is really going to be highlighting all these new developments, both in the clinical aspect when it comes to diagnosis, prognostication, disease classification. It provides an opportunity to anyone who wants to know more about alcoholic liver disease clinically to come to this meeting and learn about it. And we hope that this is going to be a sort of junction and a platform for experts to come together and walk away with some new focus in their research and also potentially some consensus.
And I'm sure it will be fascinating and educational. Dr. Szabo, AASLD President, thank you so much.
Thank you so much. It's always a pleasure to be here.